Hello, I'm Dr. Bruno Chumpitazi. I'm a pediatric gastroenterologist and the Division Chief of Pediatric Gastroenterology, Hepatology, and Nutrition here at Duke Health. We take care of children who have GI issues ranging anywhere from the esophagus, which is the food tube, down to the stomach and even the intestines. And we also help with some of the organs that are involved with the digestive system, including the pancreas, gallbladder, as well as the liver. We use our diagnostic tools, including things such as endoscopy, in which we place a tube with a light on the end into parts of the GI tract to see what may be happening, to try to do interventions potentially to help, and even to take biopsies to try to understand what may be happening inside. We also use tools such as manometry, which is pressure testing, to understand how the GI tract is squeezing. We can do reflux testing, and we can even use really interesting diagnostic imaging, for example, to try to understand the scarring that may be happening in the liver. So we take all of these tools and we combine that with our knowledge to help children with disorders that can include things such as chronic abdominal pain, irritable bowel syndrome, or even liver failure. And one very important thing that we do as pediatric gastroenterologists is we use nutrition to promote health. We work very closely with dietitians to help address a lot of issues such as poor weight gain, for example. Disorders such as irritable bowel syndrome in children are actually quite common. These disorders of gut-brain interaction can actually affect up to 20% of school-aged children. My style is first to listen. I think it's really important to try to understand what's been happening, how the symptoms may be affecting the child's life, how it's affecting the dynamics within the family, what's been tried already in terms of trying to help, what tests have already been done, and really try to put the whole picture together in terms of making that diagnosis and working with the family to come up with the next steps in terms of either the testing that may be done or even the treatments that we need to do. The most rewarding thing for me as a physician is just seeing children get better with their health. To try to explain what's happening, to try to explain how we can take steps together to have that child get better, and just hopefully seeing and sensing that there's a connection there where we're actually forming a good physician-patient relationship so that we can take those steps together.